Hello friends, welcome back to my YouTube channel Medical Chain. This is Mohida come up with new video discussing on the topic about parts of syringes and needles. What are the parts of syringes and needles? As we know, this is the most important topic in the medical field. A doctor, a nurse, or physicians and a physiotherapist, pharmacist must be know about the parts of syringe and needle. I will explain you with a simple and easy way that is easily you can remember. Before starting the video, if you are seeing first time my video, then please subscribe the channel and please like and share. I will describe about parts of syringe and I also demonstrate what are the parts of syringe and needles. Let's start the sessions. I have taken a 5 ml syringe and with needle and needle cap, and I draw the overall structure of the syringe. You can see here, this is the long tube outer structure. This part is known as barrel. You can see here, this part is known as barrel. Tube like structure, outer tube like structure. This is the long tube. This is known as barrel, which contained projections called the finger flange. This is finger flange, and this projection part called finger flange, and on the top there is a tube, small tube. This part is known as tip of the syringe or lever lock or needle adapter. This part is called needle adapter, in which needle is attached. This tip part is known as needle adapter, in which needle is attached and we attach the needle on the tip. And the barrel contains a measurement. This is measurement scale. We can measure the medication while giving medications to the patients. Till now, what we see, just three parts. This the barrel and projection on the barrel. This is finger flange and tip of the syringe. This is needle adapter. Now we see the next part. Inside the barrel there is a long structure. This long structure is known as plunger. This long structure is known as plunger. It helps during the pushing of medications. This long axis, this long part is known as plunger, and on the tip there is a rubber black structure. This known as plunger piston. You can see here, this is the black color structure I draw here. This part is known as plunger piston, and on the back there is a round shape structure. This is known as thumb rest. While giving the medication or injection to the patient, our thumb rest on this part, therefore this part is known as thumb rest. This complete parts of syringe. We see here, this is the barrel. Barrel contain measurement scale. This is measurement scale and finger and projections. This is known as finger flange, and on the top there is a small tube tape, and the long axis inside the barrel known as plunger, and on the top there is a rubber structure known as plunger piston. Black, this is black in color, and on the back there is a round shape structure known as the thumb rest. This is about the parts of syringe. Now I will discuss about the parts of needle. Needle contain a protective cap. This cap we can say needle cap, also known as needle cap. This part is the needle cap. It protect the needle to pinch the body. It protect the needle and maintain the sterile. And on the needle there is an opening, which part is attached with the needle adapter. This opening is known as hub opening, and there is a rubber structures known as hub and there is a metal shape structure, long metal structure known as shaft of the needle, and on the top there is a point. This point is known as bevel, and in the bevel there is an opening. We can see here, I draw here, there is an opening, black spots I draw here. This is known as lumen. Through the lumen, during administration of medication or injections, the medications goes through lumen to the human body. This is about the needle has 4 parts, that is hub opening, hub, shaft of the needle, and the bevel contain lumen. This is about the parts of needle and syringe. How was the video? Please do comment on the comment box. Thank you for watching the video.